Are you confused about what deductible, copay, coinsurance, and out-of-pocket maximum really mean? Don't worry, you are not alone. Hi, I'm Nancy, and in this video, we're going to clear all your confusion and doubts, step by step, about what these terms actually mean, how they work together, and how they impact your medical bills. With real-life examples. So, stay tuned till the end of this video, because by the time you finish watching, you'll finally understand how these terms and your insurance payments truly work. Let us begin with a simple question. What exactly is a deductible? In the U.S. healthcare system, a deductible is the amount of money you must pay annually for your medical care before your health insurance plan begins to contribute financially to cover your medical expenses. As per RCM, you are responsible for paying all of the initial covered medical expenses until your deductible amount is met. For example, let's say you have a $2,000 deductible for this year. You go to the hospital and your treatment costs are $1,000, which is less than your deductible. You'll have to pay it yourself. But if you go to the hospital and your treatment costs are $3,000, which is more than your deductible, you'll pay the first $2,000. Then, your insurance company starts sharing the cost after paying the deductible. It is based on your coinsurance. It may be 80% and you pay 20% as coinsurance. That first $2,000 is your deductible. As an AR caller, you must keep in mind that the deductible starts fresh at the beginning of each policy year. So, even if you met your deductible last year, you will have to start again this year. Some preventive care services like vaccines, annual exams, and preventive checkups may be free. No deductible applied to these services, so always verify before billing or discussing patient balances. Now let us move on to the next very important question. What is copay or copayment? A copay, also known as a copayment. It is a fixed amount of money that a patient pays each time they receive a healthcare service. It is a predetermined charge set by the health insurance plan, and it applies to specific services like doctor visits, prescriptions, lab tests, or specialist consultations. The copay is usually collected at the time of service, either during registration or before you leave the clinic. This system helps healthcare providers recover part of the service cost immediately, and it ensures that patients share responsibility for their healthcare expenses. Let's understand this with a simple example. Imagine you visit your primary care doctor for a regular checkup. Your health insurance plan states that you have a $20 copay for each doctor's visit. Now, the total bill for your visit comes to $100. In this case, you'll pay $20 at the clinic. This is your copay, and your insurance company will cover the remaining $80. So, a copay is just your portion of the cost that you pay right away, while the insurance company takes care of the rest. Now, let me clear your confusion between copay and deductible, because many people get confused between copay and deductible, but they are not the same. A deductible is the total amount you must pay from your own pocket each year before your health insurance starts paying its share. In simple terms, it's like your first financial responsibility before your insurance company begins to help you. Once you've paid your full deductible, your insurance will start sharing the cost of your medical bills. But copayments are separate. They are not part of the deductible, and you may still pay them even after meeting your deductible, if your plan requires it. Now that you clearly understand what deductible and copay mean, let's move on to another very important and often misunderstood term in United States healthcare, which is coinsurance. So, what exactly is coinsurance? In simple terms, coinsurance is the percentage of the medical bill that you and your insurance company share after you've paid your deductible. Yes, you heard that right. Coinsurance starts only after your deductible is met. Let's make it super easy to understand. Imagine your health insurance plan says your coinsurance is 20% and your insurance will pay 80%. That means for every covered medical bill, you will pay 20% and your insurance company will cover the remaining 80%, but only after you've already paid your deductible for that year. Let's understand this with a clear and simple example. Suppose your deductible is $1,000 and your coinsurance is 20%. You go to the hospital and get treatment worth $5,000. First, you'll pay your full deductible of $1,000. Now the remaining amount is $4,000. From this $4,000, you'll pay 20%, which is $800. That's your coinsurance share. and your insurance company will pay the remaining 80%, which is $3,200. So, in total, you'll pay $1,800, your $1,000 deductible plus $800 coinsurance. That's how coinsurance works. It's the amount you pay after meeting your deductible. Now, here's something very important you should remember. Coinsurance continues until you reach your out-of-pocket maximum, which is the highest amount you'll pay in a year. Once you hit that limit, your insurance covers 100% of your covered medical expenses for the rest of the year. Now that you've clearly understood what deductible, copay, and coinsurance mean, it's time to explore one of the most powerful and important terms in the U.S. healthcare system, which is out-of-pocket maximum. So, what exactly is out-of-pocket maximum? In simple and clear words, the out-of-pocket maximum, also called out-of-pocket limit, is the maximum amount of money you'll pay in a year for your covered healthcare services. Once you reach this limit, your insurance company pays 100% of all your covered medical expenses for the rest of that policy year. Yes, you heard that right. Once you hit your out-of-pocket maximum, you don't pay anything more for covered services. Let's understand this step by step with a real and simple example. Imagine your health insurance plan has a $1,000 deductible, 20% coinsurance, and an out-of-pocket maximum of $6,000 for the year. Now, you get medical treatments throughout the year that total $25,000 in billed charges. This is more than your total out-of-pocket maximum. For you, medical treatments. First, you'll pay your $1,000 deductible. This is your first responsibility. After that, your coinsurance begins. You'll pay 20% of the remaining bills, which is $25,000 minus $1,000 equals $24,000. So, your coinsurance share is $4,800, and your insurance company pays the remaining $19,200. As you continue receiving care and paying your share, those are deductible, copays, and coinsurance. All these payments add up toward your out-of-pocket maximum. Once your total payments reach $6,000, which is your out-of-pocket limit for the year, your insurance company takes over your medical expenses completely. From that moment, your insurance will cover 100% of all covered medical costs for the rest of the year. That means you don't need to pay any more copays, any more coinsurance, or any more deductibles. Everything covered by your health insurance plan. Your medical care expenses will fully pay for the rest of the year by your insurance company. Now, here's something very important. You should always remember, when thinking about your out-of-pocket maximum, keep this in your mind. Only covered services actually count toward your out-of-pocket maximum. Costs for things like non-covered services, balance bills, or out-of-network charges usually do not count toward your out-of-pocket limit. Also, keep in mind that each new plan year, your out-of-pocket maximum resets to zero, just like your deductible. As an AR caller, when you review a patient's account or explain their balance, always check how much of their deductible they've already met and how close they are to reaching their out-of-pocket maximum. This simple check helps you explain patient responsibility clearly and prevents confusion in billing. In short, the out-of-pocket maximum is the total limit on what you pay in a year. Once you hit that limit, your insurance takes care of the rest of your medical expenses. So, the next time someone says, "I've reached my out-of-pocket maximum," it simply means they've already paid enough for the year, and now their insurance company covers everything else. Now you know it all. What is deductible, copay, coinsurance, and out-of-pocket maximum? These four simple terms decide how much you pay and how much your insurance covers in the U.S. healthcare system. In short, deductible is what you pay first every year, before your insurance starts helping you in your medical expenses. Copay is the small fixed fee you pay every time you visit a doctor or get a service. Coinsurance is the shared percentage you pay after meeting your deductible. And finally, out-of-pocket maximum is your yearly safety limit. Once you reach it, your insurance covers 100% of your covered medical costs for the rest of the year. When you understand these terms, you can easily read your medical bills, explain patient responsibility clearly, and avoid confusion in claims or payments. So, the next time you see a medical bill, you'll know exactly what each part means and where your money goes. If this video helped you understand these key healthcare terms, don't forget to like, share, and subscribe to our channel for more simple and powerful lessons on U.S. healthcare billing and RCM. See you in the next video. where we'll learn all about prior authorization and how it really works in medical billing.